Good evening, guys. This is Renee. This is Ask the Nurse. I wanted to come back on here to talk about um, what my channel is going to be about. And so, again, my channel is going to be about how do I assist patients to navigate, through the healthcare system and how they should better engage with the physician, with their physician. There's just so many ways that a lot of us enter into the healthcare system. Sometimes it's just for an annual physical, or it could be, just due to being sick or an accident, as well as visiting loved ones. So it's so many ways that we engage into the healthcare environment. And for lay people, those who are not in the healthcare field, it can be somewhat of a daunting task. And so this is where I come in, that this is where I try to enlighten your understanding as to how do you better communicate with the doctor, or how do you identify, if you have a doctor who meshes well with you, because simply because you go to the to see a doctor for a particular illness or situation does not mean that the doctor is the best match for you. It is very, very important that you find a doctor that is going to be open and receptive to listening to you, understanding what your needs are. That is going to be really important. But first of all, I want you to subscribe to my channel, click the like button, give me some thumbs up, and share my channel. I would graciously appreciate that. I am really trying to roll my channel out, and I really want to assist patients and families to have a better understanding as to how you should prepare, when you are having a doctor's visit. So, okay, so for starters, so let's say if you are going to see your doctor about your blood pressure, okay? Typically, if you are going to the doctor and you are having an annual physical exam, you're gonna, first interface with the secretary or the triage person, or the person who's going to do your intake information. So typically, you want to come prepared. You should have your appointment book with you, but so that you'll know what was the last visitation was like. So have your book, your appointment book with you. You should have your medications with you, or have them written down. All of your medications should be written down in your book if you do take, medications. You should also have your weight, typically, and I know sometimes people don't take their weight on a regular basis. So, but if you do, that will be, helpful to the physician. So you want to, have the last time that you weighed yourself in your book. If you're coming in to see the physician because of your blood pressure, at least have your baseline blood pressure written down so that he can sort of do a comparison to what he see, based on his assessment in the office versus what has been some of the trends and patterns, that you've written down. So if there's any turning of the corner, meaning that if there's any issues that has come up, both of you all can speak from a very knowledgeable perspective. So meaning that he can sort of see what information you have, and he can compare that with what he has. And that really gives him a broader perspective as to what are some of the trends and patterns, and really how to identify, what could be some issues going on if it is your blood pressure. So once you go in and you communicate, with the triage person, they take all of your demographic data. They are going to, take your weight and height, supposed to. Certainly, they are going to take your vital signs. They may even ask to update, some of your medical histories, previous surgeries, previous hospitalizations in the past. So they're going to update all that information, in their system. Make sure, that they have the correct information. Certainly, they're going to ask you, your date of birth and all that good stuff, because your date of birth, because when they get ready to assess and prescribe medications, for you, the age does matter, so someone who is 60 versus someone who is 80, sometimes that may determine, the medications that they may want to prescribe a patient. So they will confirm that. They certainly want to utilize your name and date of birth to certainly identify who you are. So, for example, sometimes there may be a Donna Hill. There may be 2 or 3 patients whose name may be Donna Hill. So they make another distinction by asking you your date of birth because they don't want to get people mixed up, So that's a HIPAA and a very safety protocol that they utilize. So they're not asking you your date of birth just because they want to just be into your business. They really utilize that as a safety factor. So once they get all of your vitals and all of your history and your medications and your weight and height and all that good stuff, so now they have some information that the doctor can utilize. So now they're going to put your chart together. So they're going to put a little brief chart together. And so typically you want to come in sort of prepared to at least ask 2 or 3 questions. And it should be, something that you're pretty concerned about, or some patterns that, you've seen, within the last few weeks that has been going on with you. And so, so you want to have these information ready and on hand, because the doctor is not God, so he is not all-knowing, and he's not going to be able to probe and figure stuff out. So it's going to take a piece on your part to share, to divulge some information on, with him. And so that way, he can prescribe the best plan of care for you. You can expedite, your encounter with the doctor and move forward. Typically, sometimes what patients do, they come to the doctor almost like a blank slate, and then when they get in there, they want to ask the doctor 15, questions. Now, I am not saying that it is wrong to, ask, several questions if you have it, but you really want to narrow it down. You really don't want to come there and it seems like you're all over the place, because, doctors are quite focused. They want to get to, what the heart of the matter is, and they want to, understand those very pertinent things related, to a specific, disease process or physical exam or what have you. So that's how they think, and so you want to help them to best manage your care. And so, but have, pertinent questions that you want to ask. And it's okay, if you ask some questions off the cuff, that's not, pre-written down. That's fine too. But the more you come in, sort of educated and prepared, that really, it helps him. it kind of takes some of the edge or the load off of him from having to ask you a ton of questions and to guess, at certain stuff. So it really does, help the physician to help you. Um, but also, you want to pay attention to the bedside manner. So that's important. So the physician, when you are communicating your concerns with him or her, and I apologize if I'm, being more towards him, because they're her and him, nurse practitioners, doctors who are females as well as, males. So when I say him, it's just synonymous just for the doctor, period, whether they male or female. So what you are looking for is for that doctor to at least hopefully pause for a few minutes and give you their attention. So if you're talking to the doctor and their back is turned to you, and hey, we all get busy, but to show consideration, for what you have to say, the bedside manners matter, So they should at least take a pause for, a few seconds or more and hear what you have to say and to understand what your concerns are. You should sort of, be a little bit on alert if your doctor is always, they got their back towards you, they're consistently writing while you're talking to them. And I get it. I'm in the health profession. I understand, how busy things, can be, how unexpected, situations, come up, and you have to really prioritize and be able to move through, your patient load. I get that and I understand that. But in order for them to really, hear you, because sometimes people can, physically hear you, but they really are not, understanding and interpreting, the inferences that you are placing on some of your concerns. So they should be looking at you and reading your body language and all of that type of stuff, so that they can see that certain, issues are a big deal for you, or a concern, shall I say. So, for example, I'll give you just a small little story of my personal situation. So I had a family member, mother. She was extremely sick, and so I took her, to the hospital. She went to the emergency room, and so and when I take family members to the hospital or whatever, I don't feel the need to say, oh, hey, I'm a nurse. I really don't. It's just not, I don't feel that it's necessary. So I get to the emergency room with my mom, and so the doctor is asking, what is going on. So she has, she had multiple stuff going on. She had pulmonary problems, cardiac problems, and so because she had an extensive respiratory disease, they really focus on that. And I kept, expressing my sincere concern for her cardiac problems. She was in a lot of pain, physically in a great deal of pain. And so I told him, I said, I think it's this problem, it's her cardiac problem, not her respiratory problem. Well, they really, really did not listen to me. They were like, oh, no, we think it's the respiratory. And so because they didn't think that it was her cardiac, they really did not expedite, diagnostic exams in a timely fashion. And so as a result, sadly, my mother passed away. And when the autopsy was done, it was confirmed just what I had informed them that it was her heart problems that was the lethal um, thing that that caused her to pass away. So they really just kind of took it for granted that I was just, maybe um, was just making it up, I guess, because they were quote unquote the experts. So throughout my, course of being a nurse in the healthcare field, listening is a real big thing. So bedside manners, with the doctor is important, when you are communicating with them. Sometimes healthcare professionals, physicians, primary care providers have the tendency to talk to you about lifestyle changes without even assessing your lifestyle changes. So, for example, when you go to the doctor, and you're supposed to be a certain height and a certain weight, right? So, if you are considered obese or whatever the case may be, you're gonna get some very, how can I put it? I don't know if it's motivated doctor or whatever. You're gonna get them who really want to emphasize your diet and your exercise and all of that stuff. But keeping in mind, discussing, lifestyle changes with patients goes beyond telling someone, well, you have to eat, fruits and vegetables and you have to exercise, blah, blah, blah. The word lifestyle denotes that everybody's lifestyle is different. So, if your primary care provider, the physician, a nurse practitioner, if they want you to be successful at weight management, changing your diet or whatever, they need to go beyond just saying you need to, change your diet and you need to lose weight. That's a very general, broad term that does not, help you, in terms of your lifestyle. So if any practitioner talk to you, about losing weight, and I get it, sometimes they are not, nutritionists, they're not, really people that are in that vein in terms of, weight management, but they have enough knowledge to at least assess where you're at. They can ask about, what is your dietary habit, like what do you eat, within a week's time. Like 3 meals a day, or what types of foods you eat. They can gain that information from you. They can talk about your lifestyle. So tell me what type of exercise you do, or what type of activities do you do to maintain being active. They can ask those questions so that they can have enough knowledge on their plate to assist you to manage your weight better, or to manage your diet better. Just telling someone you need to change your diet and you need to lose weight does not help you. So that's important, because when you are on your journey to health and wellness, it's important for your practitioner to be connected with you as an individual, and not put out some generic information about your weight and your lifestyle. So for me, I think it's really, really important, because I see too many times, and even myself, I experience it as well when I go and visit the doctor. The first thing that they kind of want to come out of their mouth is to, oh hey, you really need to change your diet. Haven't asked me anything about how I'm eating. They haven't asked me anything about, do I exercise? None of it. They haven't asked me anything. It's just, you just need to lose weight and you just need to, change your diet. So, um, so bedside manners, coming in prepared, with your notes, and also with your questions, with your medications. And so you want to, once you close that meeting, with your doctor, you want to have a clear expectation what you need to expect next. Okay, so are we going to be taking, any tests, any blood draws, any urine, any other diagnostic tests, going forward? Medications. So are you going to add more, change, typically they do, tell you that at the time, that that you and their meeting is closing and finalizing. They definitely do tell you that. But if you are going to, or if you did, have some tests done, you kind of want some general idea as to when to expect, your test results, so that so you know. Some clinics, or offices, you can look up your lab or other diagnostics online. And other times, of course, they will call you, and if they do call you, typically they don't really tell you the results. Sometimes over the phone. So they will probably ask you to come in, for your test results. And I know that can be nerve wracking, So, say for example, if you had a mammogram, and if you can't see the results, or if you don't understand what the results are, you are going to be a nervous wreck coming into the doctor's office to get, your results. And if it's exams, like mammograms, colonoscopies, and so on and so forth, it is just good to have a support system with you, when you are getting your results. So if you can have a friend, or if you're an older person, have a child, or your husband or wife, if you can have that person come with you for those test results, that is like wonderful. That's great. I think, you should have somebody with you. Just because, you're already nervous. And so when you're nervous, you're not really taking in the information. So let's say if you do go to the doctor to get your results, and let's say if something is abnormal, it may not really be as bad as you think it is, but because the results is abnormal, it is very difficult for you to hear anything else the doctor has to say. There are missing pieces that you might miss. So that's why you should take someone with you, because the person who is with you may be a little bit more tuned in, where they can hear, what the doctor is saying to you. But when you're by yourself, you're relatively stressed. And when you're stressed, the information just gets, pretty gobbled up. And then, you have to read through some of the information again, try to, interpret and memorize what the doctor told you. And so that's why it's just best, to have a support person with you. So yes, so going for your doctor's appointment, you should have your appointment book, or a notebook with you, because even during the time that you are in the office with the doctor, you could be just taking some basic notes, just jot down what the doctor is saying. A lot of times you forget, like when you go back home and you wonder, well, what did the doctor say? I can't remember all of what he said or what she said. So you kind of want to, just take some basic notes, as to what he said, while you're with him. So that's helpful because when you go back to the doctor again, you have some information that you can refer back to. So, you can say, "Oh, doc, I remember you said, during the last visitation, I should do X, Y, and Z." So, just like you're in a classroom, you're sharing information. So, you're not going to remember everything. Your health is very, very important to you. So, just as with anything else, you should be sort of, taking in information and documenting, some of the information, when you're at the doctor's office. It just really helps you to be able to navigate it a lot better and to see, the progress and the communication, that you have with your doctor. So take your notebook with you. And I will be creating a patient notebook guide, where you can record your appointments, record, various tests that you've taken while you were at the doctor's office. Just information, that the doctor shared with you, any changes in your medication and why. So it's important if the doctor changes, any medication, you can just, jot down, why, the doctor is changing your medication, just so that you have a broad perspective of, why these things are happening to you. And just in case, if an event happened and you have to go to the emergency room, God forbid, you can just carry a notepad with you. And so if you have your notepad with you and you have the capacity to communicate, with the practitioner, at the hospital, you could say, "I went and visited my doctor, X, Y, and Z. These were the, the changes that he made. Here's why he made these changes." So it just really helps, you and the healthcare team to really, get a broad perspective of patterns and trends. And it really, it helps you. In your patient, notebook, guidebook, what have you, you want to jot down if you do have any allergies. So it's very, very important if you do have allergies, to make sure that you have that, in your book. Even though most people can memorize, what allergies that they have. But there are others that have multitude of sensitivity to medications. And so it's just really, really important for you to have that information. Jot it down somewhere. For our older population, it is really, really important that you have a support person with you, during your appointments, because there's so much information sometimes that are coming at you that is very difficult for you to process a lot of information sometimes. And so having a support person with you, that can, reinforce what the practitioner had to share with you can be, helpful. There are some individuals, in their 80s, they can take in a lot of information with no problems. But on the average, older population, 70s, 80s, sometimes it takes time for them to process a lot of information, because when you're at the doctor's office, they're saying things so fast, so rapidly, and they're not, keeping up with the pace with where you're at, so they're kind of moving quite fast. So it's just good to have a support person with you as an older person when you're going to visit the doctor. And next time, I think I would talk about if you have diagnostic exams. Now, if if you want me to assist you in how to interpret some of your diagnostic exams, you can write it in the comment. You don't have to put your name there. I know some of those things are personal, or you can just kind of ask general questions around some of the diagnostic exams, and I can help explain it. Now, again, I cannot do any diagnosing of any disease processes, but I can sort of help explain the reason why you're taking those exams, and just kind of whether the exam is normal, abnormal, should you be concerned, and what you should be asking the doctor based on some of your diagnostic exams. Now, I know some patients are very savvy. You ask me questions, you already know that these tests are on the abnormal end because you have a chronic stuff going on. Well, I don't really want you to ask me questions that you fully understand. I want you to ask me questions that you have a real question about. So some diagnostic exams are new, it comes up, and you just kind of want to know. So I'm okay with answering questions about your x-rays, about your lab results. I can answer those questions for you, and I can also maybe just give you some suggestions, depending on how much information you share with me. So let's say, for example, if I see some diagnostic tests that speak to your possibility of being a diabetic and so on and so forth, and I may, communicate back and say, hey, did your doctor recommend that you see a specialist like an endocrinologist? I just may even ask you that. That's just to give you some cues or prompt some ideas, so that you can get the best care for your health. And I understand, in these very difficult, tough times, insurance is a big thing. People don't have, the money and the insurance to really go and see, various specialists. Now, my channel may not, and the reason why I'm just, emphasizing may not, for the most part, I won't be navigating to recommend, any particular specialist, because this channel is not about case management. Case management is really, connecting you to various resources. So this channel is really about educating you as to how to navigate yourself and what are the right questions you need to be asking your doctor, what tests that possibly the doctor may can look at and examine, and where are you at in terms of the particular disease process. Possibly I may suggest that you may see a particular specialist, and these are just suggestions. These are not me telling you what you should do. It's not hard and fast. It's just me throwing out some suggestions and minor recommendations just to prompt your thinking, and so that you can utilize that and go and ask your doctor, do you think it's time for me to see a specialist? Because a lot of times when you are talking with your doctor, you're pretty much typically talking with your primary care physician. You're not talking with the specialist. Now, if you are talking with a specialist, then that's different. But the concepts are the same. You still come in with, your information, and you still want to be able to ask questions. You still want to kind of sort of document, what was going on during the time that you were meeting and talking with your doctor. You still want to do all of those things. It's still important, because depending on your health, sometimes it's a lot of information that you are ascertaining. So it always behooves me. People will write down information, related to their bills, to their house. They will write down information about vacation. But when it comes to their health, people I know that lots of data are in the computer systems, and so it can easily be retrievable, when you get to the doctor. But it is just helpful to have it on hand, because if you are, trying to retrieve your health information, sometimes it just takes time. It might cost money, so just having, sort of a quick way to view, some of the information or your interaction with the doctor is just helpful. You should have that information on hand, because sometimes you might be seeing several practitioners for various reasons. And typically, the various practitioners should be communicating with each other, because anytime your doctor refer you to a specialist, they should have interdisciplinary meetings, and everybody, should be on board in terms of the plan for your health. But sometimes things fall through the cracks, and so, but if you have your little handy guide with you, you can, just sort of share what the other practitioner, spoke with you about, as it relates to your health. So that is really what my channel is going to be about. Also, being that I have worked, in the healthcare field in various different departments and units, but more specific to cardiac adult health. I also, did nursing education in cardiac adult health. So I will also be talking about cardiac disease. So my channel is going to be sort of more focused, on answering questions for patients and family members. But also, I will be sharing information with new nurses, experienced nurses, relating to cardiac health. So probably more specific to cardiac rhythms and things of that nature. So I may talk about that and speak to some of that information and how to better care, for the patients in that area. And another area that I currently work in is hospice and palliative nursing. I really, really do enjoy hospice nursing because it just really is sort of who I am. I am a person that really is very passionate about the human part of nursing, the art form of nursing, as well as the science part of nursing. But I really, just absorb a lot of the art form. The art form of nursing is how we connect in therapeutic communication and our active listening ability, and just really supporting the patient throughout their health continuum. So that is really what I am very, very passionate about. And so I may even, talk a little bit about, hospice care and how you as a family member can navigate into finding the best hospice for you, what you should expect, while you either, you the patient, or if your loved one is going into have chosen hospice, and what should be some of those expectations and what hospice is all about. So I may touch on some of those things as well. So again, please subscribe to my channel. Please, do the thumbs up, like, and share. I hope you have a wonderful day, and I will be back soon. So have a great evening. Bye.